All right, I'm live. So this turned into a little bit of an event I scheduled yesterday. As always, well, not as always. First, we're going to talk about shoulder pain today. Okay, so if you're interested, if you have some shoulder pain, if you've been told maybe you have shoulder impingement pain, that's what we're talking about today. And as always, yesterday, Thursday afternoon, I was doing a workout. I came over to my pull-up bar. I was going to do a little hang here for this reason. And I thought, maybe I'll shoot a little video, do a live video on Facebook. I always like to reach out to a few friends and clients and things like that by doing so. But then one thing led to another. I thought about something else and I looked up and I lost track of time. So I rescheduled it for today, but I did go through a few more notes. So this is for anyone who has shoulder pain, a shoulder an ache or a pain. If you go to a doctor, they'll say you have shoulder impingement problems. They might use a bigger word like subacromial impingement or pain syndrome. Okay, we like to use the word syndrome in medicine, right? Which basically means if you reach high, your shoulder hurts. Okay, I reach here to get kitty litter off the top shelf, a coffee cup off my shelf. That bothers me. Okay, it may bother you more if your palm is down. Okay, so I just talked to my friend Erin. Erin is a volleyball player in high school and college. She's a perfect example of someone who has these shoulder impingement problems because they spent a lot of their childhood into college and in their 20s swinging overhead like a volleyball player. Okay, so we do see this in volleyball players. We see this a lot in baseball players as well. But we see this with everyone, and the reason is that our body gets good. I say this almost every video. Our body gets good at what you ask it to do most of the time. And we are asking our body, our shoulders, to sit here and just relax in this position here, or we are slouched forward at a computer. So our arm bone, well, a lot of things happen. Our spine flexes forward, our shoulder blades round forward a little bit, and our arm bone, our humerus, actually sits forward in the socket a little bit. So all those things, all right, that we get good at a computer, you can do a lot of things at a computer, do not translate well when you go to play on the monkey bars with my kids that I did a couple of years ago and realized, wow, I cannot brachiate as well. I can't do monkey bars as well, right? And so, or I can't just reach overhead. I can't grab a rebound playing basketball. And then I talked to a lot of my clients, particularly my older clients. Is it that they're older? I had a conversation with my 45, 48-year-old clients this morning. Is it that they're older, or have you just been arms at your side for 10 years, 20 years, 48 years that you begin developing these problems? So what do? There's a lot of traditional PT, physical therapy. You can work on your rotator cuff. This week in class in kinesiology, we are working on the shoulder girdle. This is a shoulder blade. If you were to take your left shoulder blade off, it would look like this. Your shoulder girdle is just your shoulder blade moving around on the rib cage, okay? It's gonna sit like this. My shoulder blade's probably a little bigger than this, but it's gonna move around. So if I shrug my shoulders, it's gonna shrug up like that. If I reach out to someone and grab something, it's gonna move this way. So there's a lot of movement that my shoulder blade does. If I reach overhead, it's actually gonna rotate like this and then back down. So two things might happen. Your shoulder blade may not be moving well on your rib cage. That's problem number one, and that's something that needs to be addressed. But what typically happens is that your shoulder blade may be moving well enough, but what happens is that the arm bone, when it moves, it pinches with this bone right here. If you're to reach out and kind of tap the end of your shoulder bone, what you got going or what you're feeling with that hard tap is this bony process. It's called the acromion process. So the arm bone sits like this. So my position, my left arm, my arm is like this here, okay? It's that, okay? So as it's sitting, right? Let me find the right spot. Good. So it's sitting there to where that's just a comfortable position. And you have that space there, right, between that bone we're talking about, this acromion, and your arm bone. Okay, there's space. So if you lift your arm here, if you go to hit a volleyball, if you go to pick something up, that moves pretty well together, and there's lots of space, and that's all happy. As we get older, a couple things happen, and when you go to move your arm up, I go to reach high, now this bone kind of cranks, and it gets bothered by a couple things. One is this bone can actually curve, it can actually change over time. Some people just have a more of a curve to this, so it does impinge that shoulder movement a little bit more than others, but it's just something, the plasticity of our bones, how moldable our bones are. And then the ligaments around this area as well can all stiffen. They can all contract. They can all tighten up. If you're spending most of your time here, then you go and play in a charity volleyball game, or you're just reaching high, or you're picking your child up over your head, something like that, and you feel that pain. What's happened is that this bone is getting in the way. The ligament that also sits on top of here, that ligament, it's this coracoidocromium ligament. It's like it makes a little bit of an arch. That gets tight, all right? And then if you have any kind of rotator cuff or history of rotator cuff problems, there's a rotator cuff tendon that sits right under this bone. And that, if that gets inflamed or a little bit of scar tissue or gook in there, you can feel that as well. If you've heard bursitis, that's a popular one that doctor will say, well, you just have bursitis in your shoulder. And what he's saying, or she is saying, is that bursa is inflamed. It's a little jelly bean looking thing. And if it gets a little bigger than usual, that causes impingement as well. Okay, so what do? An orthopedic surgeon, and Dr. Kirsch, that's the book I showed earlier. So Dr. Kirsch was a surgeon. He's doing surgeries, especially like in the 70s and 80s. And what they do is a subacromial, so they go underneath that bone, release or decompression surgery. They're trying to just change the anatomy or structures of this area to create more traction and more space in there so that arm can move freely. He wasn't a big fan of the surgery. He didn't love the results. Then he goes to a playground, plays on with the monkey bars, and realizes my shoulders bothers me when I go into that position. So instead of thinking go get surgery, he just thought, I'm going to practice hanging more often and see if that will help the situation, and it did. So he began researching this and looking into this idea. All right. So again, to go through, I don't like talking too much without moving, and my students do the same thing. So think about your shoulders for a second. So get in your body. If you're sitting at your desk chair or just standing watching this, watching on your phone, do a couple shoulder rolls, okay? And what you're doing is you're taking your shoulder blade, again, and you're just moving your shoulder blade around. You're just kind of going up and around and moving that shoulder blade and just checking in to see how well does your shoulder blade move up? How well does it drop down? Squeeze your shoulder blades together. How well do they kind of retract and move backwards? How well do they round forward? And then do a full shoulder roll. Does your neck move when you do this too? Because a lot of the muscles that come off of your top of your shoulder blade connect to your neck bones, your cervical vertebrae, that also your skull as well. So just loosen all that up first. Make sure your shoulder blades are moving well, and then check in and see how this feels. And then we're going to go through the specific exercise of this book. And the idea, and why I'm extra interested in this, I do have my clients hanging. So if you've had a healthy shoulder, this is a great thing to do, right? Do these hanging exercises. If you've never had shoulder pains, but maybe just feels a little stiff, you can do these exercises. If you've been diagnosed with some sort of shoulder impingement and you want to just try something different than conventional physical therapy, maybe your physical therapist may recommend this as well. Some PTs are recommending this. If you're going to just kind of self-diagnose and you've Googled and you've figured out your own problems, because we're all guilty of doing that, right? Or we all do that. It's a good proactive thing to do. In some circumstances, you can just go ahead and try hanging some, okay? If you've had a shoulder replacement, if you've had a rotator cuff surgery, I'd be a little more wary of this, right? Listen to your body. Don't do it because I just told you to do it. That's my disclaimer. But try these out and see if you can loosen up these spots, loosen up this ligament, and change that bone in there a little bit to where you can get more freedom. It may irritate you at first, and Dr. Kirsch will say this in the book. It could bother you the first time you do it, the first few times you do it, but then within a few days, if not just a week or two, you can really make an enormous difference on how your shoulders feel, okay? So the exercises in and of themselves, again, let's go through these first, and then we'll talk about why this is kind of the first of a couple videos. There's the hanging exercise. Hanging exercise can be a number of things. I have a pull-up bar, so I will come and my palms will be straight forward about shoulder width, and I will just kind of sink into this and hold that stretch, okay? That could be enough if you can hang. So I have clients that might do this. And again, so already this morning, I had a 74-year-old client who hung from one of my pull-up bars for maybe 2 times 30 seconds. I had a 78-year-old who hung a couple times, 3 times 10 seconds. Who else? I'm 45-year-old female, mother of 3. Another 48-year-old, she did her hanging today. So it's just always part of a workout. It might be mobility at the end of a workout. It might be a warm-up at the beginning of a workout, or it might be mixed into something. We might work on a couple squats or get-ups from the floor, and then we go hang for 30 seconds. So something you can combine into your day. Or you can just think about it throughout the day. If you can grab the top of a door frame, I know I say this, I'm 6'5", most of you know me, and not everybody can grab the top of a door frame. The top of your refrigerator, anything that not only is a high reach, but is also a little bit of traction. You want that stretch, okay? So I don't just go here, I can reach this and be kind of relaxed. I actually want to drop into this and hang some, okay? And again, discomfort, this is usually I say, if it hurts, don't do it. If it feels sketchy, it probably is. But this is one where you're kind of working through a little bit of that. Again, Dr. Kirsch's advice. So you can start with doing 10 seconds a couple times a day, and then you're going to work up to doing, maybe a minute total every day. But then maintenance becomes maybe, 35 seconds, 2 to 3 times a day, 3 times per week. Okay. All of these exercises are, they're like brushing your teeth. They're like flossing. You don't brush your teeth once and you're finished. And that's, physical therapists get frustrated with this. And a lot of people I work with will say, well, my lower back felt good when I was doing my physical therapy exercises for those 6 weeks, but then I stopped doing them. And instead of looking at the kind of that reactive approach to PT or physical therapy or rehabilitative exercises that your chiropractor or therapist gave you, they're just habitual exercises you do every day. And they're also nice preventative exercises. They're corrective, or they're prehab, we call them, whatever word you want to use, in that if your shoulders are healthy today, begin doing this now. And the idea is that you're going to prevent future shoulder problems down the road, okay? But the other exercise, it's not only doing this hanging exercise, but what he recommends is grabbing, you can use a light dumbbell, 5-pound dumbbell, but you don't have to use anything at all. So let's check in with your body again. Relax your shoulders at your side, and with palms straight forward, all right, I'm going to just reach high and just see, how does this feel? You can do this in a mirror, but you can just listen to your body. When you're holding this position, is your elbow straight? Do you feel your shoulder blade? Do you feel your shoulder joint? Like, where is that? Is there impingement in front? Okay, you can check in with impingement a little bit more by turning your thumb in. So kind of lead with your pinky and go up that way. And you may feel that impingement a little bit more, okay? You can go out, if that's like 0 degrees straight ahead, you can go out about 30 degrees. How does that feel? Okay, so you can kind of check in with different ranges of motion. If I'm reaching straight ahead, I can go out diagonally about 35, 40 degrees and go up there, okay? You can also put a hand here and lift your elbow and see, do you have pain there? That's sort of the simple test for shoulder impingement pain, okay? This one here, how does that feel? How does that feel? And then you can turn your thumb down, pinky up, and go up, and you have some impingement with each one of those moves, okay? So then you get into hanging and shoulder raises. So again, that's kind of your test, but that's what you want to know. Can you just reach high? And you can do this 20 to 30 times. He recommends, Dr. Kirsch, grabbing a light dumbbell and doing this 30 to 45 times. And if you could do it about 30 to 45 times, then you can add the weight. I have a sneeze coming on. Excuse myself now. Okay, so be aware, does your neck change at all? So switch arms. Do you compensate with your neck? Do you throw your neck forward? Remember, your shoulder blade's connected to your neck, right? It's all connected. So when your shoulder moves, your shoulder blade moves, does your neck move, okay? How does that feel to go upright? All right, then out to the side, you can go all the way out, touch there and back out, okay? So these are exercises I do with some people, but if we're working on this idea and this protocol, we will do these exercises just to feel out before we load these movements, before you take down a heavy bag of kitty litter, right? Or a cooler or a grandchild, right? You just want to see, how does it feel just to do this with no weight in my hands, or a dumbbell or barbell or kettlebell, and then do this, right? So straight forward. And again, slowly doing this 10 times. Do you lean back? Does your chest open up? Do you lean back just in order to reach straight up? Or can you stay straight forward, chin tucked, and go straight up overhead without doing this? Okay, that's why you can throw your back out, reaching high overhead, because you're moving your spine so much, okay? So you're finding something to hang on. The other thing about hanging is you can also hold on to anything. So 2 doorknobs, if I'm in the picture here, and just hang back this way. I'm still in an overhead position, and I'm also getting a traction through my shoulder. All right, so I'm getting a little length and traction through my shoulder, and I may feel stretch through here, which is great. You take some deep breaths, try to expand your rib cage as much as you can, but just get that shoulder position there, okay? So again, you might feel a little bit of impingement pain, but as long as it's not too bad, and it may even go away after 30 seconds or so of hanging there, okay? So I might work on someone's ability to hang here, and then here, and then here, right? If you have a pole in your basement, maybe, something like that, you can go higher, and then try to get into overhead position, okay? And see how that feels. And then after you're doing this daily, 10, 20 seconds at a time, then you can begin maintaining with 3 times per week. So the hanging exercises, and then one arm at a time, I like just to go up about 10 to 20 times. Get a lot of reps here. We're trying to build some strength. We're trying to stretch out that ligament. And that position here, I like to just go here too and just reach straight up overhead. Be mindful of this movement and go up high. What does it feel like to go this way? And then what does it feel like to go palm straight forward? All right. We have students researching this, one student in particular. So we are doing some research on a lot of the athletes here, and then some other people that I work with. And so I'm going to hopefully follow back and have this conversation with some of you, with some of my clients, with athletes here at Webster University, and just see, can we, and see what kind of results we get. Can we improve impingement pain? Can we improve shoulder range of motion? Does it do anything at all? We're going to feel that out. Okay, so try these out. Again, it's a pretty good book. It has a lot of scans. If you really don't like the idea of hanging at all, okay, your balance isn't great, it really hurts too much. Another way to do this, the safest way, I guess, would be to lie on your back. Let's say on your floor or on your bed, and grab like your headboard, or something stationary. And then as you're lying there, scoot away from it, because you want that traction. That's the idea, right? That you want to reach high overhead, and then you want a good traction kind of pulling up there each time. And so lying on your back, reaching overhead, grab the leg of the couch, or reach under and grab kind of the hem of the couch, or whatever that would be called, and then scoot away so you get that good stretch, and hold that for 30 seconds. That'd probably be the safest way without hanging overhead, okay? But don't go grab a monkey bar and go try to hang, because it's also going to challenge your grip strength. It's going to work your core. It's going to decompress your spine. There's a lot of other good things going on with hanging. So either way, a hanging exercise can be great. If you have relatively healthy shoulders and you're under 60, under 70, any age, I apologize, I shouldn't say age at all. I have people of all ages doing some of these things. Go ahead and start hang. If you can swing a little bit, pay attention to where your shoulders are, pull your ears through your shoulders there, and have a little fun with it. And I think it's a great just kind of daily thing to do. After sitting, my desk is 15 feet over here. I always get up, I walk over here. It's the first thing I do. I drop into this and I just hang, left, right. I go underhand grip, I hang there, and I might do 2 minutes total. I do that a couple times a day. It's made a big difference. All right, so I'll finish with that. Shoot me any comments, ask me any questions. Yanni says, what's up? Hopefully Aaron's watching this later, and hope this made a little bit of sense. And I look forward to following up on this idea. So we're going to have some more people doing some of these exercises and see how it goes. All right. See you next time. I have to hit the off button. It's over here.